Hello, my name is Cheryl, and I started using Remar about a year ago because I was having difficulty passing my test. I have severe test anxiety. So the first time I took my test, I did not pass it. I had a panic attack, and it just wasn't good. So what I did was I just started doing research. UWorld did not work for me. ATI did not work for me. And Archer did not work for me. So I was scrolling down Facebook and I saw Remar. And then another one of my girlfriends told me about Remar. And so I purchased. I got the quick fact books. I got downloaded everything that I needed to download. Just whatever you offered, I did. I watched the videos a couple of times. I did schedule to take it again, but I chickened out and I didn't go take it. I lost my money. I said, I'm not going to take it because I'm not going to do anything but fail again. So I'm at work and I'm talking to my DON because I still work in healthcare. And she was like, you're going to go take that test. And I'm like, not going to do it. So we created another study plan along with the study plan that I had from Remar. And we just every day I would do questions and quizzes and watch a video and then do something, write something, a little essay about the video that I watched. If it was a video on blood gases, if it was the video on the babies, if it was a video on the geriatric care, it didn't matter. I would write down what I learned. And then I reread everything and rewatched everything. Well, Wednesday, December the 18th, I didn't tell anybody. I went and took my test. My test cut off at 86. I had a meltdown. That screen went black and it turned off. It asked me 5 questions about the facility and sharing some answers or something like that. And I just knew. I was like, oh. I couldn't even look at it. Every day for 2 days we were at work. They were like, go look and see if you passed the test. Go look and see if you passed the test. Wouldn't do it. Didn't do it. We had a code at work and I went to respond to the code. And one of the nurses came up to me and said, I don't see your name. Did you pass? Blah, blah, blah. I had a meltdown during the code because I thought they just had taken my name out of pending, everything. So our DON went in the corner, looked my name up and came out running and said, you passed, you passed, you passed. So now I am now a nurse. And I'd like to thank you. Keep helping people study. Anybody who thinks they can't do it at any age, know that you can because I did it.
Hello everyone, my name is Regina MSN, all the way from Southern Africa. I would like to say a very big thank you to Professor Regina and her husband, Brother Mark. Thank you so much for changing my life and the life of a lot of nurses. When I started preparing for NCLEX, I started by using Saunders and UWorld, and I was doing the questions there. But the day that I knew about Professor Regina, and she was saying content first, I knew I had arrived. I quickly bought my quick facts and my V2. By going through the V2, I knew that I was going to pass. So in 3 weeks time, I was ready for my exams. I went in and on question 85, that was it. Thank you so much, Professor Regina. And thank you for increasing our faith. Knowing you has changed my life forever. You always used to say, have faith. And when I went for the exam, I was not afraid of anything. I was full of faith and I did it. When the exam cut at 85, I didn't know whether I had passed or not. But I was so confident because I had conned. Thank you for changing my life and my family's life. I know my life will never be the same again. Thank you.
Guys, good morning. Hope you can hear me. I'm doing this video to appreciate Rima, especially God for using Rima, to come into my life to bless me. So I want to say that I graduated June 2023 of last year, and I purchased Archer because my friends were buying it and it was cheaper at that time. So I purchased Archer. I took my first NCLEX in August of 2023 and I failed. Meanwhile, I took my NCLEX 4 times. So the second time I scheduled to take it in December. I purchased UWord. I had a private tutoring that I was paying like $250 every month, and I bought Kaplan and I was using videos on YouTube everywhere. Whatever I see NCLEX question I want to study, like I was very serious, but I failed with 150 questions. So I was devastated. So I waited. I studied, I bought Rima, but when I was studying, I was like doing it, I wasn't serious, I didn't even do I was really very unserious. So I took it in April this year, 2024, and I failed again. I told myself, I said, no, Elsie, it's too long. Like, you're wasting so much time, money, and everything, and your energy. You have to be serious if you really want to pass. So I purchased Rima again because I told God, I said, what program is going to help me? So I purchased Rima and I used Rima. And I was so serious this time. I finished everything. I scheduled my exam December 4th and I went to take my exam build. The exam showed up at 85 questions. I was so scared, like, God, I failed again. I was like, anyway, if I fail, I'll reschedule it. So, but when I opened my computer to check, I found out I passed. And I was like, how did I do it? Because this exam was like 1 through 3 compared to the ones that I took before. It was very easy at this time. I was like, thank God. So I just feel like I have to share this testimony because I know there are other people who are like me struggling too. So I want to encourage you guys, never give up. If you give up, you lose. So I told God, I was like, God, if I can pass this exam, I was going to give my first salary to the church, which I'm willing to do when I get my first job. So I want to thank God for using Rima to bless me and for helping me to make the decision to get the good study material that I needed for my exam. So this has really changed my life in so many ways. I preserve life and everything, and I really want to be able to go out there in the field to help people, make more money, take care of myself, and live the dream life that I want to, and help my mom especially. So I passed NCLEX engine using Rima. I'm a Rima nurse. I can't wait to purchase the first shift, which I'm going to be buying. I have to read that book because I really need to buy that book, The First Shift. Thank you, Rima. Thank you.
Hi, it's morning here in Kenya and it's a sunny day, so I'm excited. I like it when it's warm and sunny. So I'm officially a Rima nurse. I must pass the entry. So I just passed on Wednesday. So it's winning Wednesday, so I passed on Wednesday and I'm so excited. So I'm officially a Rima nurse. I started the journey back last year, did my NCLEX in September and I failed. So it was such a disappointing time, when you read for something then you fail, it's a disappointing time. So I got to know about Rima in March. I was just going through YouTube and got to see some Rima nurse motivation, Monday motivation, and some winning Wednesday motivation. So after the Rima class, you all know that what happens, there's a verse and there's an encouragement, and it really strengthens your faith. So I just want to show you. I don't want my video to be so long, so I'm looking at the time and I'm like, it's 1 minute already. So these are my books. You'll note that I have all the 2 trainer books. Mine is one was the free trial, so the other one is the V2. So for the free trial, I did the free trial and the quick facts. I took a photocopy because my friend had a V2, so I didn't purchase one for the V2. For the quick facts. So for the V2, yes, I did purchase. So this is the photocopied version. Yeah, but I went through everything. And then this is the quick facts book. You can see I went through everything, and I think I went through it like thrice. Yeah, so that's it. You can, you will, you must pass the NCLEX, guys. See you.
Hi, Professor Regina. Hi, Mark. Hi, nurses, Remar nurses. It's Stacy Ann, your YouTube person, Natalie Harrison, aka Smash That Like Button. I just came on to tell you the good news. It paid off. Oh my God. When I tell you I studied faithfully and prayed over everything. It's such a great feeling. I just found out. Ooh. Okay. So I can't tell you how good I studied. I studied. Like, I studied to the part where I can't even share my book. Look. I write everywhere in my book. When I tell you, this is not the kind of book that I can give someone else to study from, because I had somebody look in my book and say, Stacy, I took a look in your book and I thought I was going to have a stroke. No. I took all the notes I possibly could, went over my went over my V2 videos all the time, day in and day out. Got in front of that computer, and when I say I prayed, and I'm like, all right, God, you got this. Everything is left up to you now. And it paid off. I'm a Remar nurse. I'm a safe nurse. I'm an LPN. Woo! I would just want to thank you guys for the motivation, just for being such a great professor. And like, without you all, I would not. I mean, this and this. I mean, I got a folder in here, but it's that beautiful face right there. Okay. All paid off. I'm so excited. I get to sleep in tonight. Okay. Yeah. I just want to say thank you for everything, and God be the glory. I have, what can I say? Thank you for everything, and I'm just so excited. I have that 3 letters at the end of my name. So smash that like button. All right, love you guys. Thank you so much.
Hello everyone. Hi Dr. Regina. My name is Elsie, and I did my NCLEX exam yesterday on the 4th of November, and I passed. I just got my results today, and I said to share with you and to encourage someone out there. I'm a first-time taker. I used the book, The Quick Facts for NCLEX book. I read this book back in fun. I read this book all the way, and I used the workbook also, the V2 workbook. I used it. I did the workbook back to back, and I used the V2 videos. Dr. Regina, those videos are awesome. They helped me a lot in passing these exams. I thank God for everything, because it wasn't easy, but it was worth it. The journey was not easy, but it was worth it. But I want to categorically state it here that what really helps me with my exams, because I had used other resources before now to study, but the best of them that helped me get this NCLEX passing is the V2. I encourage everyone who hasn't been on V2 to go there. You cannot miss it with the V2. Thank you so much, Dr. Regina, for all you do. Thank you so much. I am a Remer nurse.
Welcome everybody. Your host today will be Professor Regina MSN. I have 24 years of nursing experience. Most of you may know that I started nursing when I was just 16. And so I am here. I'm here today. Hi. Welcome to day 2 of Love Your Content. 16 years of registered nurse. Amazing. 14 years nurse educator. I love what I do here. Over 50,000 nurses have joined the REMAR family. And we do it every year. Every year, people are telling other people about REMAR. And I just cannot believe how we are all over the planet. I know on tonight I have Ghana in the house. I have Ohio in the house. I have Liberia in the house, Kenya, Uganda, the Philippines, Mexico, Brazil. This is an international class, so give yourselves a hand for showing up. This is Love Your Content. It comes from we're going to be filling out this workbook right here, day number 2. This and everything that we talk about on tonight is part of a bigger class that I hold. It is called my V2 program. And if you are not studying a full comprehensive NCLEX review, well, I have a treat for you. My V2 program includes my quick facts books, my lectures. You'll hear me talk a lot about it. There may be even a REMAR nurse that comes on. But for this, we have an amazing price on my NCLEX review, $89 for the, it's even lower than that. That's right. It's not, it's even lower. It's $69. It's $69 for the V2. So if you don't have my program and you're interested in it, we haven't changed the price yet. It's $69. Go to remarnurse.com to join my full review. Okay, everybody, you made it to class tonight. I see you, Ohio, Naples, Florida, the United Kingdom as well, Congo. Everybody is representing where they are from. As we move into the course class, let me tell you, there may be some people watching who have failed the NCLEX. You've already taken it and you did not get the results that you wanted. So you are looking for what to do now. If you have the workbook for tonight's class, you will see that inside of the class is a very important form. It is called the grief form. I call it the NCLEX grief form, the NCLEX preparedness form. And this is essentially a document that I created that will help you try to figure out the reasons why you possibly failed. I know there can be many, many factors in not being successful on the NCLEX exam. So if you take some time and read this and answer the questions honestly, by the end of it, my hope is that you have the answers that you're looking for. If you don't have this document and you want it, please email me at support@remarreview.com and I'll make sure you get this. And again, we help people who have failed NCLEX, and it's all right, because at the end of the day, nobody's going to ask you how many times you failed NCLEX. No patient will ask you that, but people will ask you, why don't you have your nursing license? They'll ask you that. So I am glad that you're here because that means you're ready to go. And we are going, this is our clinical simulation for day number 2. We are actually doing postpartum. We did pregnancy yesterday and we were able to take great care of our patient. So if you have your workbooks, go ahead and get ready. I'm about to give you report on your next patient. I'm going to give you report on your next patient. Greetings, everyone. If this is your first time joining this class, it is intense, but the idea is that you have been studying maternity and now is your time to show up. Now is your time to show up. So we're going to get into it, but if you know me, then you know that I am not standing here alone. There is another partner on this REMAR team, and he's going to prepare to come up and address the class. We have over 1,000 nurses, so let us get prepared to welcome. Who is it? Put it in the comments. It is Pastor Mark, Elder Mark. How you doing?
Hello, everybody. Once again, welcome to day number 2 of this amazing Love Your Content journey.
It's been good.
Listen, have you been in love before? Or have you ever thought you were in love and you got into it and you realized this isn't love?
Oh.
Now, a lot of us have made that same mistake before, thinking you're in love, but then you find out that the values don't align. The person may not be really for you. And what happens is that we got in love, or we thought we were in love with an idea, but it wasn't based on substance, right? And so at the end, the process left you with having more questions than answers, right? Left you with having more questions than answers. And some of you guys have experienced this with the NCLEX journey. You've partnered with some resources. You wanted to get into nursing, but it wasn't based on the substance necessarily that it needed to be based on. And so in order to not have more questions than answers, what you have to do is actually study the content of love. And so that's why I love the Bible so much, is because the Bible says, it teaches us what love is, or actually who love is, because the Bible says that God is love. And so when you know that, then you can base everything from that, and you won't feel like, I'm infatuated and I'm so in love, but is it of God, right? And so on tonight, Regina's going to take you in to the NCLEX V2, help you to study the content so that you know how to answer the right questions, right? And so we are praying for you on your journey, that you will receive an understanding, that you will say, like, okay, before I was anticipating becoming a nurse, I'm anticipating taking this test, but now I know exactly what I need to know in order to be successful.
Perfect. That's what we want.
Right?
Yeah, we want them to feel like I know what I'm supposed to know.
Absolutely. And so we're not just going off of feelings. We're not just going off of anxiety or letting emotions take over, but this is a walk of a faith walk that's going to take you step by step through a process so that you can know that you're going to have success at the end of the journey. So right now, what we're going to do is the most important thing is we're going to go to God in prayer so that we can get started with this class and go ahead and do what we need to do.
Let's do it.
All right. All right, guys, let's go ahead and pray. All right, Father in heaven, we thank you for just allowing your Remar nurses to come here this evening to spend this time with us, Lord, and also spend this time with you as they are focusing on this task of passing NCLEX, Lord, and expanding their nursing career and fulfilling the vision that you have given them. I ask, Lord, that you would give them increase financially, that you would give them increase in peace, also that you would give them increase in protection and safety. So as their attention is turned towards this, they also turn their attention towards you. Watch over their households, Lord, their families. Lord, the nurse yesterday said she's had to sacrifice time spending with her family. But Lord, I ask that you would reward them 100-fold, Lord, for the time that they have put in, and so that they know that their time is going to be beneficial in changing their lives and being able to also be instruments of honor for you. So we ask, Lord, that those that are testing would be able to honor the process and remember their questions, remember their answers, and most of all, remember with them on this journey. In Jesus' name we pray. Amen.
Amen. Amen. Okay, right, everybody say amen so we can get started.
Let's go.
We're going to get our patient report right now. All right. Thanks, Mark. Thank you so much. Okay, patient report box is here. Here is what I need you to know about this client. So I'm going to read this to you. You have, are we ready? Are you ready? You have patient B. Yesterday was patient A. Today is patient B. I'll read this to you. 30-year-old, gravida 2, para 2. I got that? Gravida 2, para 2, who delivered vaginally a 9-pound, 2-ounce term infant. Okay. Delivered this infant at 1600. Okay. It was an uncomplicated pregnancy. Okay. With forceps delivery. Okay. Somebody says, I don't have that page. This is, what page is this, please, you guys? Tell me what page is this. Okay, so it said mic check. Can you guys hear me okay? All right. So it was an uncomplicated pregnancy with forceps delivery. Okay. And what's going on also as well is that the normal infant had vital signs that were normal as well following birth. Okay, we're on page 15. Thank you. Thank you so much. Okay. All right. I have page 18, so maybe that's why the confusion is. Page 15, everybody. Okay. The baby girl was put to breast for 10 minutes, 5 minutes on each side. Ibuprofen, 800 milligrams PO, okay, was given at 1700 for abdominal pain. Okay, yes, it's blank. So I wanted you to fill this out. It's blank on your page. So you got to fill this out. Okay. The vital signs are 80 over 65, pulse 112, respirations 22, temperature 98.1 degrees Fahrenheit. Okay. And the oxygen is 91% on room air. 91% on room air. Okay. So this is our patient that we are going to be taking care of. Now, if you need to screenshot this, screenshot it right now, because I had a Remar nurse that popped on, and I'm going to, while you guys are taking report, writing things down, I'm going to bring on the Remar nurse, okay? Because I want to hear how this person is going to give us the knowledge that we need for real life information. So let me bring the nurse on here. Okay. Hello.
Hello, Remar.
How are you?
I'm really happy to meet you in person. I'm really excited. I'm really happy. I want to say to all Remar nurses, I am one of the happiest person here right now. I am. And I want to tell you, thank you, thank you, thank you a million. Thank you to your husband. You're a great inspiration. And I really want to say to all Remar nurses, all online now, follow the program. Follow the program. You can't be wrong. I fell off track. I was studying. Well, actually, when I finished school, people tell me about all sort of programs to go in.
Mm-hmm.
I tried Kaplan, I tried UWorld, Archer, and I was stuck on the questions. I was doing questions, because I was saying to myself, if I know the pattern of the questions and I could decipher the answers and things, and I spent time on it, I came across you on YouTube, and I heard you said over and over content, but I kind of shook it off the first time, and I prayed. I went into the exam on last year September 5, and I tell you, I struggled. I remember the first 10 questions. I could tell that I only got 1 out of 10 right.
Wow.
And I struggled. I did up to 149 questions. And I know I didn't do well when I came out. But then I came back again, and it's like your voice was in my head. Content. So I hooked up again. And this time I went to V2. I followed the program, pregnancy. Listen to me, Remar nurses, it is real. Follow the content. Start with pregnancy and child and follow the program. Well, I work 2 jobs. And it was hard to really follow a structured pattern, but I followed the topics one after the other.
Perfect.
And I remembered that when I set for January 10th of this year, I was stuck on V2. I didn't touch any questions. I was stuck on V2, and it's like the lectures were just coming real to me. I could explain it. I learned it so that I could explain it to anybody. And I would, to tell you the truth, pregnancy is not an easy topic to just get over. But I learned it. and I could explain it. And then I went on to other topics, and I said to myself, learn one topic at a time. I was
Amazing.
jumping all over the place,
Mm-hmm.
one topic today, and I didn't learn it. I just was
Yes.
on the surface.
It's a
But
common mistake. It's a common mistake.
common, yes.
Common. Donald, how much money would you say you spent before finding Remar? How much money did you spend on all those other NCLEX reviews? Keep it real with us.
To tell you the truth, I didn't even check the amount. I was just spending.
Oh, gotcha.
I didn't really come to say, okay, I was just spending because I said, I just need more questions. I need to see what other sites have, and it did not work. So I'm telling
Why do
you.
you think that is, Donald? Like, why do you think, where did you learn that from? Where does it start? The idea that questions are the way to go.
Okay, here it is. When I was leaving school, when I was leaving school, the last part of the program, we were told that NCLEX changed, and so we're gonna having this next generation style questions, and so they thought they were teaching us how to do it. So I said, okay, if it's changed, then I need to know how these questions are structured, and practice them over and over, and maybe it will help. So I started practicing, and to tell you the truth, to give a little credit, I learned how the questions are structured, and I learned a little about, how they can put 4 diseases together with similar symptoms, but you have to make a distinction, find out what that one distinction is to get the answer right. But then, as you said, I listened to one of your lecture, and I remember you said the questions along with the rationales, they are only on the surface. They don't go into the depth of it. And I really, really, I'm telling every person listening, it is true. It is just surface. And so when I started studying the lecture, and started knowing the topic, and I tell you the truth, the last thing I studied on V2 was mastitis. Mastitis. And the last question I got was on mastitis.
Yeah, there you go.
Number 85, when I saw it, number 85, 4 diseases well wrapped up in one passage. And I was able to look, the moment I opened it, I could tell this is mastitis. And when I answered the question, put in the intervention, the computer shut down.
I love it. So you were able to pass in 85 questions.
85 questions. And I'm telling you that I was seeing the answers. I could just look at the question and just go through. When I finished, I had over 2 hours left.
Oh my goodness. What a turnaround in experiences from the previous experience. I'm telling you, NCLEX is not as big as we make it to be. If we study the right way, you can pass it. You can pass it.
It is so true, because I was seeing the thing so plainly compared to the first time. I mean, I struggled the first time.
Oh my goodness. So, okay, before I let you go, let everybody know where you're from.
Okay, I'm Jamaican. I came here. I came here, and I have a history. I don't want to take up the time to tell you all of that.
Okay.
But I struggled through sickness, and it came. I came around. God helped me. I'm healed of it. I had epileptic seizures. I missed classes by the months. If you see my report from high school, it was poor.
Amazing.
And
this is a
God
great testimony.
God healed me. I got high school diploma at age 40.
Oh,
And
wow.
today I'm 58 years old and I'm a Remar nurse. I'm on now to my BSN. I just got my job. I got a job. I just finished training for the first time today, and I'm moving on.
All
And I'm
right,
telling you,
everybody, congratulate Nurse Donald. Thank you so much for taking your time to give us the
I
motivation
thank
that we
you.
needed. Representing Jamaica in the house. What an amazing testimony. Oh, man, you guys, this is more than what we need. This is what somebody needs to see, that it's possible. No excuses. Just do what you need to do. Ah, all right, you will hear
Indeed.
from me again. Amen. Thank you
Yes,
so much.
I
Thank you.
am really happy to be here. I'm glad to share my testimony. Thank you, Mark. Thank you, Regina. It is real. Remar
Yes.
is real.
All right. Bye bye.
Thank you. Bye bye.
Oh man, guys, this is amazing. But listen, it doesn't stop here. I got another Remar nurse. Hello.
Hi, Professor Regina. Hi, everybody.
How are you? I hear myself in the background. So if you're listening to me somewhere else, turn it off.
Oh, um, maybe. Oh, I don't know what to do. No,
It's just you and it's just us.
yeah.
Okay. All right. Okay. Tell me where you're from. What's going on?
So my name is Olga. I am an IN. I am originally from Cameroon. I moved to Canada in 2015. I was a nurse back home, and it's been a struggle to get into nursing here. It's really been a struggle for me, my personal experience. I was able to get my RPN in 2019, and I worked for a couple of years, and I got my RN last year. Um,
Okay.
it's just, I don't want to make it a long story. It's just
Okay.
been a struggle back and forth getting my credentials evaluated and
Mm-hmm.
actually getting the ATT to take the NCLEX exam. I finally got it in November last year, and I was starting to study for November 2023.
Yeah.
I started to study for the NCLEX RN, the next gen NCLEX, and I was so anxious. I was all over the place. I didn't know
Mm,
what to use to study because I am a visual person. I like to see what I'm studying. I'm not an I'm not a very good audio person because I'll just get lost. And
got
if
it.
if topics are so long, I just get off
Yes.
topic. I start thinking of grocery and other things I have to do.
That's me. That's me too.
So I bought Archer. A friend of mine told me she used Archer. I bought it and it wasn't working for me. The 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 videos, they were good, but they were so long, like an hour
Mm-hmm.
and more. I'm like, no, this is not for me.
Mm-hmm.
I went to YouTube. I saw you actually on YouTube when I was checking, but I'm like, I don't know. I don't know what to do. I don't know if this is for real, if it's the same thing. I saw Simply Nursing. I
Mm-hmm.
bought that too.
Mm.
It was okay, but it still did not work for me. So my sister-in-law, she's here as well. She's from Cameroon and she's an IN as well. She told me, oh, because I always
Mm-hmm.
share everything with her. She told me,
Yeah.
oh, she has a coworker who just had her RN and next gen NCLEX, I think a couple of months ago, and she said
Mm-hmm.
she used Reamer nursing to study. So I was like, oh, I saw this lady on YouTube. I follow your videos before, but I did
Uh-huh.
not purchase the package.
Mm-hmm.
So she was like, you should try her. And we're Christians. No offense to anyone, we're Christians. And she's like, oh, I don't know. I just saw her videos and just the fact that they pray for people, she was just so drawn to you. So I'm like, okay, I'm gonna try it. I'm gonna give it a try. If it doesn't work, fine.
Mm-hmm.
If it works, then at least I tried.
Yeah.
So the same day I came back home, I I purchased the package, and I went through. I did know. I used a trial version first of all,
Sure.
and I watched the first few videos. I'm like, this is absolutely what I need. The
Mm-hmm.
videos are concise. They are. That's the V2 for RN. Sorry, the
Yes.
videos are concise. They're straight to the point. It
Yep.
teaches me what I need to know, and I learn very easily. I had my little book I bought from the dollar store. I was taking my notes, And for some reason, I did not read everything that came with the package I bought.
Mm,
A few days after, I received a quick fact booklet
yeah.
in the mail. I'm like,
Mhm.
oh, this is a booklet she kept talking about on her YouTube videos. So
Yeah.
the quick facts is the bomb. It's so amazing. Like,
Yay.
it's the go-to.
So Nurse Olga, how long did you study for when you got the V2? That's a question people ask. How long did it
Oh,
take you to get through V2?
personally, you say 30 days, but if you're if you're if everybody's different, if you're a quick learner, I think even 10 days, 15 days, you can use the V2 and you can still pass. To be honest.
Wow.
Yeah.
Okay.
I just had I have a 2-year-old little girl and I have a son, and struggling with them and studying, I used 30 days, not up to 30 days anyways, but I used the 30 days and I studied and I passed. 85
Wow.
questions, the computer shut down.
This is my second 85 and out testimony tonight. And
I
so
it was
phenomenal.
Yeah, you guys, yourself and Mark are doing an amazing job. I don't know how to thank you enough because you're helping people, even the people you don't know how much people you're helping out there. You're
Thank you so
I
much for coming on here. Please,
Yeah,
thank you so much, because
that's
it is true. It is, people usually find us after using multiple other things. And it
right.
always seems like, I don't know, it's like people don't think I'm real. Like people think that this is not a real thing. So I so appreciate you coming on and just giving your testimonial and letting a lot of international nurses who may be watching and waiting for their paperwork, not really sure if it's ever going to happen. You are an inspiration to
Yeah.
them that
It
the
will happen.
process can be
It will
completed.
happen
Yeah,
eventually. Yeah.
it will happen. Yeah. Oh my goodness. Thank you so much. I just
Thank you for
appreciate you.
having me. Thank
Yes,
you
you'll
so
hear
much.
from me again. I'm going to reach out to you later. Okay.
Okay. Take
All right.
care.
Bye-bye. Oh my everybody. I wasn't expecting that. Thank you so much for allowing these Remar nurses to come and just tell their testimonial, because hopefully it inspired somebody. All right, it's time for us to get back into this class. Let's go. Okay, the patient that we had again, just for reminder, patient B, 30-year-old, gravida 2, para 2, who delivered vaginally a 9-pound, 2-ounce term infant at 1600. So imagine this happened today. It was an uncomplicated pregnancy with forceps delivery. The normal infant vital signs following birth. The baby girl was put to breast for 10 minutes, 5 minutes on each side. Ibuprofen was given. This was given to the mother. 800 milligrams PO at 1500 for abdominal pain. These are the vital signs, okay? 80/65, pulse 110. Okay, you're writing this stuff down, you're remembering it. Respiration's 22, the temperature is 98.1, and the O2 sat is 91% on room air, All right. Here is the doctor's progress notes. Okay, here's the doctor's progress notes. The client reported relief of pain. Okay, rates it a 3 out of 10. I'm sorry, this is the nurse's progress notes. The client reported relief of pain, 3 out of 10 after ibuprofen was given. Fundal assessment completed. Heavy lochia rubra noted with 5 dime-sized clots on the perineal pad that was saturated with blood. Okay. Bed linens also had evidence of blood stains. The fundus appears boggy at 3 centimeters above the umbilicus. Dr. Abdul notified. Client given new gown. Nurse Henry Smith. We know that nurse, don't we? Okay. So the first question that I'm asking you, and this is critically thinking based off of what you know about maternity, what you just received in report, how much bleeding is considered normal after delivery? I want you to write it down. Give me the amount. The vaginal amount is considered normal. What is that? And then also the cesarean amount. I have here the number 1 to start you off. So vaginally, what are we going to be expecting? It's a normal amount, okay? And then C-section-wise, what are we going to be expecting? This is question number 1. See, I did all of my notes today, earlier. This is what your workbook should look like, okay? As you're answering these questions. Great job, everyone. I see it. We have, for bleeding, we have 500 milliliters vaginally. And then we have 1,000 milliliters for a cesarean section. Write that down. Okay. It does seem like our patient that we have here has some bleeding going on, right? But we are in the middle of a case study, so we have to keep going. We have to keep looking for other things. All right, let me ask you this. Somebody said this is hemorrhaging. Tell me, what are 3 possible causes of postpartum hemorrhage? What are 3 potential causes of postpartum hemorrhage? And this is where I'm asking you to demonstrate what you know, okay? 3 possible causes. She did not have a cesarean section. So if our patient is indeed bleeding, and also remember, what do we have up here? We have her electronic health report. So we have currently her electrolytes, okay? We have her CBC. What are some reasons? Here, I see some great things. All my maternity nurses are showing up. Somebody put retained placenta. Oh, good, forceps delivery. Somebody put epilepsy, eclampsia, not so much. These are the ones that I have down. These are the ones that I have. And also the expectation is that you know these clinical terms. Maternity is very much clinical. So I have here 3 causes of postpartum hemorrhage. The first one is uterine atony. What does that mean? Uterine atony. Write down uterine atony. I also have lacerations of either the cervix or the vagina. What would cause lacerations in this patient? Why would the patient have lacerations? Great job. Number 1, the uterine atony is a weak uterus. Okay. What would cause lacerations of the cervix is what I asked you. I said the baby's too big. It's not. It's the use of the forceps. Remember, the forceps had to be used because of the size of the baby. Okay. And then I also have here, did somebody put this down? Did you get this one? Retained placenta. Retained placenta. So if the placenta does not come out in one piece like we're expecting it to, but it comes out in pieces, our client will still continue to bleed. I'm gonna write the good ones down. Somebody just put big baby. Okay, when I do this again next year, I'm gonna put that down, big baby. All right. Question number 3 that I had. Now, write the reasons for the need to obtain the following laboratory values. In other words, we have here, I want you to write down the CBC and ultrasound. Type in cross is there, and a platelet count. What are the reasons why the doctor would order a CBC or an ultrasound? This is me testing you with next gen concepts. You know why they give us the laboratory values now? They'll tell you how much potassium is. They'll tell you what normal sodium is. It is because nurses that can recite from memory normal laboratory values were actually harming patients because they didn't know the reason for that laboratory value. So nobody cares that you know potassium 3.5 to 5, right? No, that doesn't matter. But do you know why we need a potassium if a patient is on digoxin? Or do you know why you never push IV potassium? Things like that is what matters for next-gen NCLEX. So I'm asking you, why is a complete blood count necessary for this patient? And if you don't know that, then you're not quite a safe nurse. You're going to get there, but you're not quite a safe nurse yet. Do you see the difference? So the level of studying that is required for next-gen NCLEX is absolutely content-based. Okay. So I have here for these, okay, CBC, and I see people are saying to detect anemia. Absolutely. The CBC is going to tell you your hemoglobin, your hematocrit. And if we look at our patient, how is she doing when it comes to her complete blood count? What do we see here in her laboratory results on this page right here? Okay. What do we see here that is troubling, right? Look at her hemoglobin. She has a hemoglobin of 6. All right. So that's why you would do the CBC. What about the ultrasound? What is the ultrasound going to show us? And you have it. Yes, absolutely. The ultrasound is going to show us. So the CBC is the hemoglobin, hematocrit, and also the platelets. So let's not forget about the platelets. That's important too. But the ultrasound is going to show us if there is retained placenta. Yep. The type and cross, that is going to show if the patient needs a blood transfusion. You want to make sure that that blood matches with the patient. And then the platelet count as well is going to be needed, because if our patient is hemorrhaging, do they have the platelet support to begin to have the clots that they need? And I think we did see evidence of that with the patient having 5 dime-sized clots. Right. Okay, how are we doing? I'm looking for you to get 8 out of these 10 questions correctly. So how are you doing? And they're going to get more challenging. Trust me. Trust me. Okay, let's do... Okay, let me do this. Let me see how you guys do it. Number 4. Number 4, I'm asking you this question. What are 2 non-pharmacological actions that the nurse, okay, or that can be done to stop postpartum hemorrhage? Meaning, medications aside, what can you do? You have to get both of these right in order to get this question right. And remember, everything that you need to know about how to answer question is given to you in report. One of the things that NCLEX stresses for question writers is to put the answer in the stem, okay? Put the answer in the stem, because we're just looking to see the connection, okay? 2 non-drug actions that can stop postpartum hemorrhage. I see one of them, but nobody has put the second one down. Okay. Oh, yep. Marie, you have it. Marie, I feel like Marie knows, because she comes to class regularly. So these are the 2. Massage the fundus and put the infant to breast. Those are the 2 acceptable ones. Okay. Being able to massage the fundus and putting the infant to breastfeeding. Okay. Those are the non-pharmacological things. Did you do that? All right. Okay. So let me do, did you guys get that one? Breastfeeding. Yeah. Okay. All right. The next question, for question number 5, what am I looking for? Okay. Okay. So just really quickly, because somebody said, what about, what was it? Emptying the patient's bladder. So what I'm looking for here, and the question that you're being asked, is what can stop postpartum hemorrhage? Okay, so if we talk about what can stop postpartum hemorrhage, it's going to be massage or getting the patient to breastfeed so that natural oxytocin can be released. All right. Okay, let me do the next question that says this. Okay, what I want you to think about is anticipating orders. That is another big thing for your NCLEX, is to anticipate the orders. The physical, the physician, okay, actually the physician, sorry, writes the following orders. Fill in the missing blank. So insert 2 intravenous sites for hemodynamic instability, okay? All right. So what I'm asking you to do right now is give me 2 IV medications that should be given to improve hemodynamic instability. Okay. Does that make sense? And when I mean hemodynamic instability, I'm not talking about oxytocin, okay? I'm not looking for oxytocin, because the hemodynamic instability needs to address the blood pressure of your patient. What did I say the blood pressure was? Patient's blood pressure is low. In report 80/65, okay? Oxytocin is not going to do anything for my patient. I cannot wait for oxytocin. What can I give? All right, your patient has, and I want 2 IV medications, okay? So 1, I see people putting, oh, that's a good one. I didn't have that one. These are the 2 I have. All right, the 2 that I have here, I like that other one though. And then also, so give me 2, and I want you to write them down on your paper, because I'm trying to see if you can just think about them before I give you the answer. And then give oxygen via a what? What route would you give oxygen? And then at how much would we give? What route would you give for your oxygen here? Okay. So I see some people saying mask. I see some people saying nasal cannula. This is safety. Okay, this is safety. Did we get the 2 medications? All right. So hemodynamic instability, looking at everything that our patient has going on, the correct answers are going to be bolus. Okay, give a bolus. Some people say it could be normal saline or lactated ringer. I would take either one of those, normal saline or lactated ringer, because that's going to help bring the blood pressure up. It's going to help. Also, what do you know about your patient's hemoglobin level? I have blood. I didn't see anybody put blood, a unit of packed red blood cells IV, because what is our patient's hemoglobin right now? It's 6. It's 6. So these are the treatments that I would be anticipating. Also, the non-rebreather mask is going to be most appropriate for our patient who is hemorrhaging. 6 to 10 liters, okay, per minute. Okay, 6 to 10 liters per minute with a non-rebreather mask. Why is non-rebreather mask over a nasal cannula? Okay, why a non-rebreather mask over a nasal cannula? Did you get that one? What? The non-rebreather mask is used in emergencies, number 1, and it is going to give the patient pure oxygen, and it's going to allow you to give the patient more oxygen too. Okay, great job, great job. So what you're doing now is just seeing if you are able to anticipate the care of the patient, if you are able to manage an emergency situation. But if you don't know the treatments, then you can't manage it. All right, I'm moving on. Are you still doing good? You still happy with your numbers? Okay. We are going to number 6 here. Here we go. Another question about this patient who we know seems to have some hemorrhaging going on. I asked you this. The physician writes the following orders, fill in the missing blank. We need to give medications to reduce the bleeding. Okay, the bleeding. So postpartum hemorrhage. What medications can we give to reduce hemorrhage? Okay, now this is the part where we're actually addressing the bleeding from the uterus. And so, of course, I'm seeing the first answer. That's one. And then the second answer comes from okay. And this is why every nursing student should have this book, because in the back of this book is the very important, my favorite, pharmacology section. Okay. So you get in here and you will know the medications that NCLEX are going to ask you about, specifically when it comes to maternity. Okay. These are the major ones. So I'm talking about, what are we going to give? Yep. What are we going to give for postpartum hemorrhage? Great job. I see it. All right. So we can give oxytocin. Of course. Of course, we're going to give oxytocin. We also can give ergonovine or methergine. We can give either one of those for postpartum hemorrhage. If this is your first time seeing these medications and you aren't sure how they work, please write them down. This is your opportunity to study, and look up things you don't know. Okay. Great job. Okay. Remar nurses, you got that one right. Okay, so now I can go to the next question here. Right. The next question says this. Whew. Based on the client's electronic health record, which medication should be given to prevent complications in future pregnancy? Okay. So based on the electronic health record, meaning you have to have the packet here to look at the patient's laboratory values. Yeah, I see it already. You made quick work of that. Underneath the complete blood count, it tells us that our patient is RH what? It tells us that our patient happens to be RH negative. So do you know what we give in terms of that? And then it also says our patient is HIV negative too, but we need to focus on the RH negative to prevent future pregnancies. What do we give? Absolutely, absolutely. So the correct answer is going to be, and this is what I want you to know, because I see some people putting just RhoGAM, but for NCLEX, please be studying RH immune globulin. Okay. I know other NCLEX reviews, they have you looking at that, that trade name, and every time I see them, I just cringe, because you need to know the generic names of these medications. That is how they're going to show up. So the RH immunoglobulin shot is given to pregnant women who have RH negative blood. The medicine is given it's given intramuscular, or it can be given an IV injection. Okay. All right. Good job. Good job. Good job. Okay. Now I'm going to press you. Okay. Now I'm going to press you, and I'm going to give you a single choice question. It's really challenging, but I want you to use your critical thinking skill. Here is the question. It says, the oncoming nurse assessing the client for possible postpartum hemorrhage, okay, which we're already thinking, would expect which finding to be the earliest indication? What's the earliest indicator of postpartum hemorrhage? Is it number one, a respiratory rate of 23? 2, blood pressure from 130 to over 80 to 120 over 80. 3, a temperature of 101.3 or a pulse increase from 82 to 105. Which one would we say would be the earliest indicator? Is it going to be the respiratory rate going up, the blood pressure dropping, the temperature, or the pulse rate? Oh, I'm so happy. See, I'm so happy we are all on one page tonight. Whew. All right, let's go. The correct answer, you did fantastic. It is indeed number 4. Good job. Good job. All right, so the nurse should monitor the client's vital signs. This is why it's so important every 15 minutes during the first hour postpartum, because an early sign of bleeding for a postpartum client includes elevation in the pulse rate. So the body compensates for a decrease in blood volume by pumping the heart faster. All right, so the blood pressure does drop, but it's going to take you a little bit longer to see that first. We expect the temperature to rise after a delivery. That's kind of normal. And there's only a slight increase in the respiratory rate. So very good. That pulse rate, a woman becoming tachycardic, is an early sign. All the maternity nurses must have showed up because you guys are doing extremely well. On fire. Okay, let's try this one. Number 9. Okay, y'all love y'all maternity. The client reports to the postpartum charge nurse of a reddened and painful breast. Based on assessment of the client's report, the nurse tells the client to, okay? So the client says that her breast is red and it's painful. Based on that, what should the nurse tell the client? Number 1, stop breastfeeding because you probably have an infection like mastitis. Remember, Nurse Donald said he had to study mastitis, okay? 2, I will notify the healthcare provider as you may need medication. 3, continue breastfeeding because this is a normal response in breastfeeding mothers. Or 4, breastfeed only with the unaffected breast. Well, what should the nurse say to this mother who is saying that the breast is red and it is painful? Okay, I see some 1s. I see some 3s. So you got it down to 2. Some people are putting 2 too. The correct answer is absolutely number 3. Continue breastfeeding because this is a normal response in breastfeeding mothers. Remember, in report, what did we hear? We heard that indeed the mother had to have the baby put to breast for 10 minutes, 5 minutes on each side. So as a new mother, this can be extremely painful, right? This can be extremely painful. So this is something that's normal. What do we actually tell the mother? You got to continue to do it. You have to continue to do it. We are not worried about, and it could even be because of engorgement, like early engorgement, but these things are all normal. We should not tell the mom that mastitis is an issue because is it time for mastitis to be an issue? Has the mother had time to develop mastitis? What do you say? No. Mastitis does not occur until later on. So, to ask the question, is it not supposed to be painful? It's not supposed to be painful. Let me say that. Breastfeeding is not supposed to be painful, but is it? Yes. Why is it painful? Particularly on the first postpartum day. Why is it painful? Because number 1, the baby may not have a good latch. 2, the positioning might be off. And so these things can all cause pain and redness. Now, once the mother gets the hang of breastfeeding and the baby's latch is appropriate, breastfeeding is not painful. But in the beginning, can it be painful? Absolutely. Absolutely. So there are many reasons. And the pain could not only be from the baby, it could be engorgement, it could be, other things. But do we expect to see this? Yes, we do. Okay. Yes, we expect to see this. And we are encouraging the mom to continue to breastfeed if that's what she wants to do. All right. Again, yeah, maybe the mom doesn't have experience. So there is a lot of reasons why it can be painful, but we're not necessarily, this is not an emergency situation. And you have to be very careful because not only does it say here, because somebody asked, well, should we not let the healthcare provider know? We can, but that is not what you're given here. Number 2 says, I will notify the healthcare provider as you may need medication. And that is not going to be appropriate. Okay. So you have to take the exam. What do I say? That's in front of you. And the exam that is in front of you, only number 3 can be correct. So when you're taking this exam, don't go off into what it should be. What if this happens? Just look at what is in front of you. Okay, just look at what is in front of you. All right, let me move on to the next question here. This is the question. Here we go. The nurse is now assigned 4 other clients. Okay, which should she see first? So now you have your patient, but now you have 4 more patients. So here are the patients. Who is the most important to see? Number 1, a prima gravida on the first postpartum day with hypoactive bowel sounds in all 4 quadrants. 2, a multipara 3 days post a cesarean section with moderate lochia serosa. 3, a prima para on the first day of delivery with a firm fundus 2 centimeters above the umbilicus. Or 4, a multipara on the first day of delivery reporting vaginal pain with 3 centimeters of diastasis recti abdominis. Okay. Who is the priority patient? And again, this is question number 10 in your workbook. So if you have it, I'm just reading that one. I'm just reading that. So this is the tricky part of NCLEX because you have some nursing students who see many patients with abnormal assessments or many patients with normal assessments. So you have to pick who's the priority. So even now we are divided on who is the person that we should see, who is the person we should see. And it is going to be number 3. Yes, number 3. The prima para on the first day of delivery with a firm fundus. Look at the position, 2 centimeters above the umbilicus. Did you see this patient as the one that you should go to? If you did, you're doing really great with prioritization in postpartum because we had a lot of different factors going on with these patients. So this is the layering that I'm talking about of content. You can't just do a question and understand all of the factors that are going on with these different patients. You have a patient here, this is our top priority because the fundus should not be positioned above the umbilicus after the delivery. So this can indicate either an over-distended bladder or uterine autonomy or excessive bleeding. And so if you are not aware of all of these conditions, you might miss this, okay? You might miss this. Number 1, some people pick number 1. This patient, they did have hypoactive bowel sounds, but this is the first postpartum day, all right? And if a person has been given some medication or what is normal in delivery, then you have, the bowels become slower. the bowels become hypoactive. All right. So initially, number 3 is the correct answer because of the misalignment of the fundus. All right. I also asked this question: were you a safe nurse during your shift? Everything that we went over was to evaluate you on the principles of pregnancy and postpartum care. This is a major subject on the NCLEX because these patients are extremely critical. And if you're taking care of a postpartum patient and you're guessing, you could do extreme harm. Okay. Maternity is a dangerous unit for some women when the nurses ignore their symptoms. You see it all the time in the news. All right. And so, again, one of my things is that making sure that everyone who's ever under the sound of my voice understands the difference between just memorizing numbers or being a safe nurse. I don't want you just memorizing rationales from a question bank. I want you to understand what you are doing. Okay. People's lives are in your hands. And so because you have this knowledge, that means you also have this power in just a short time. Yeah. So no matter how you did tonight, you come off as a better person because you've learned some new things. That's it. You learned some new things. All right. And then my next question was this. All right. Are you going to show up tomorrow? Let's get back into it. Right now, what we're going to do, open up your workbooks. We have one more lecture to do. We're going to finish our pregnancy lecture. And then guess what? In your workbook is a lecture from the free trial that you will be able to go into V2 right now. If you don't have the full V2 program, you can do the trial and get the normal and high-risk newborn lecture. But we're going to pick up from where we left off yesterday. And if you are getting the V2, check this out. So our prices are starting now at $69. Holler for a quick start. And then we have the $109 if you want to do 3 months. So this is a phenomenal opportunity for you to go ahead and get your license on this time. All right. So I'm going to take you inside of the V2 and we're going to pick up where we left off. We're going to pick up where we left off yesterday. And yes, the class is on Mondays and Wednesdays, every Monday, every Wednesday. Rain, sleet, shine, we're here. And those times are Monday at noon Eastern time, Wednesday at 9 p.m. Eastern time. Okay. All right. We're going into the V2 to finish where we left off from yesterday. It's going to start. Ready? Are you guys ready? Okay. Now, there are 2 complications of pregnancy that I want to look at specifically. Preterm labor is one, and then also preeclampsia. So preterm labor, let's define it. Preterm labor is any labor before 37 weeks. There are 2 medications I want you to know. The first one is if you give terbutaline, you want to watch for tachycardia in the mom and in the baby. The second is if you magnesium sulfate. Magnesium sulfate will actually decrease 3 things. And this is very important as a general safety point for NCLEX. Do you know the 3 things? The first one is respirations. That's right. Magnesium sulfate will decrease your patient's respirations. And you will see them decrease less than F. Number 2 is decrease urine output. And we are looking for a decrease less than 30 milliliters an hour because that's normal urine output, about 30 an hour. The last is decrease deep tendon reflexes. The normal magnesium level that I want you to write down is 1.6 to 2.6. You know what? There's 2 medications that I also want you to know. We're going to add them to the bottom of this chart. If you give Ritodrin, you need to watch for tachycardia and hypokalemia. If you give nifedipine, it will cause hypotension, and hypoxemia. The next complication during pregnancy that I want to talk about is preeclampsia. You guys may be familiar with preeclampsia. It's the hypertensive state seen in pregnancy from an unknown cause. So it's high blood pressure during pregnancy, and the cause is really not known. But there are 3 defining characteristics of preeclampsia. Number 1 is hypertension, of course. 2 is proteinuria. What does proteinuria mean? Protein where? That's right, in the urine. Now, should there ever be protein in the urine? What do you think? No, not at all. And the third characteristic of preeclampsia is going to be edema. And remember, I talked about that edema, that puffiness in the face, hands, and feet. Now, there are certain risk factors for preeclampsia. Moms who are under 18 or over 35. Also, women who suffer from obesity or diabetes mellitus. African American women as well tend to have preeclampsia. And then women who have multiple gestation or twins or triplets, more than one baby. These are the women who may suffer from preeclampsia. Now, the NCLEX maternal emergency condition is the HELP syndrome. And I want to just define what makes up the HELP syndrome. So each letter in HELP stands for a condition. So the H stands for hemolysis, and that refers to the breaking down of the red blood cells. They become fragmented. The EL stands for elevated liver enzymes. And then the LP stands for low platelets. You know, our nursing care for a woman who has preeclampsia is pretty specific. We want to put the patient on bed rest. We certainly do not want patients with high blood pressures walking around the units. What side do we turn mothers on who are in distress? Do you remember? Is it the left or the right? It is the left. We want the moms on the left lateral position. We also need to monitor for, write this down, we also need to monitor for eclampsia. What is the difference between preeclampsia and eclampsia? Do you know? With eclampsia, the mom now begins to have seizures. So we don't want our preeclamptic moms to begin to have seizures. So we also need to initiate seizure precautions. You guys already know seizure precautions. I'm not going to go over them. Now, when it comes to treatment, what we're writing down in our notebook is bed rest and magnesium sulfate. Bed rest and magnesium sulfate. The only cure is to deliver the baby. Now, we've talked about preterm labor. We've talked about the medications that can stop it. But if we can't stop it, then labor progresses. So let's cover our labor and delivery overview. Labor, if we define it, is the onset of regular contractions that increase in frequency, strength, and duration. If we want to help labor along, what medication do we give? That's right. We're going to give oxytocin. And oxytocin is going to help that uterus to contract. And if the uterus is contracting, then labor is beginning. NCLEX sometimes like to ask, if you give oxytocin, when should you stop it? So you guys need to know, you stop it when the contractions are 2 to 3 minutes apart and they last 60 seconds. Now, the stages of labor, we're going to talk about them. The stages of labor are divided into 4 parts or 4 stages. We're going to cover those 4 stages, but we're going to start with the first stage of labor. And actually, the first stage of labor is broken down into 4 parts. So you have pre-labor, you have latent or early labor, and then you have active labor. And then after that, finally, is transition. So let's just go over them. Pre-labor is essentially days before labor begins. And this is when the mother is cleaning, she's excited, she's preparing for her baby. Latent or early labor is when the cervix is dilating to a certain distance. And that distance is 0 to 4 centimeters. Active labor, the cervix is dilating 5 to 7 centimeters. With transition, the cervix is dilating 8 to 10 centimeters. But remember, with transition, this is not the stage to push. You don't start pushing until the second stage of labor. I want to go over regional blocks, hydromorphone, and morphine. Now, with regional blocks, they are usually administered by an anesthesiologist. And you have to be very careful when they are administered, because if you give pain medicine too early into the first stage of labor, then it may slow the labor down and actually prolong the process. Consent also needs to be signed if a patient's going to have a regional block. I want you to read about hydromorphone and morphine in your quick facts pharmacology section, because these are also used to manage pain during labor. Now, the second stage of labor, what is that all about? The second stage of labor happens when full dilation occurs. And I mean cervical dilation, where the cervix has reached 10 centimeters. So the second stage of labor is pushing until the baby comes out. Now remember, after the birth of the baby, you need to suction the nose and then the mouth. The third stage of labor is the delivery of the placenta. Yes, this should come out in about 30 minutes after the baby. The placenta needs to come out in one whole piece, not many pieces. There should be no fragments. Do you know what is the biggest issue if pieces of the placenta are left in the uterus? Yes, hemorrhaging. The mom can begin to bleed, and also a few days later, infection will begin to set in. So it is important that the placenta comes out in one whole piece. The fourth stage of labor is called recovery. And this is the critical period after the delivery of the placenta. During the recovery stage, the fundus assessment should begin. Remember, the fundus should be midline. It's also normal for the mom to now report cramping as the uterus begins to contract. Don't forget, frequent vital signs are very important during this entire process. For NCLEX RN, we are going to take an opportunity to get into some advanced clinical topics. One of them is going to be electronic fetal heart monitoring. This is an important skill that I want you to be very confident on if you get one of these questions on your NCLEX exam. Now, remember, with the electronic fetal heart monitoring, we want the strip to be reactive. A reactive strip is a good sign. A reactive strip contains 3 things. They are A, accelerations, B, no late or variable decelerations, and C, long-term variability. Now, if you're looking at a fetal heart strip, you will notice that there are 2 long rectangular boxes. I want you to just put down the top box represents the fetal heart rate, okay? And the bottom box is describing the contractions of the mom. So that gives you some basic orientation. Now, let's go over accelerations. What is an acceleration? An acceleration is just an increase in the baseline heart rate. That's it. Okay? It is a good sign. Now, what is a good acceleration? Some experienced nurses will call it 15 by 15. So that just means 15 heartbeats or 15 seconds worth of acceleration. So you have an increase in the baseline by 15 heartbeats, and it lasts about 15 seconds. The cause of accelerations are fetal movements. Now, let's look at this first strip. It is early decelerations. All right. So there's 3 kinds of decelerations. The first one that we're looking at is an early deceleration. Early decelerations are caused by head compression. If you look at an early deceleration, it actually looks like it mirrors the contraction. So the opposites are shown here. As you can see, as the baby's heart rate is dropping or decelerating, the mom is contracting. The mom is contracting. So the peaks and valleys mirror each other. The treatment for early deceleration is just to monitor the client because this isn't a normal and an expected finding. So if you think about an early deceleration, when a mother is contracting, when the uterus is contracting or squeezing the baby, the normal response is for the heart rate to do what? Should the heart rate go up or should the heart rate go down? Right, the heart rate should go down. So early decelerations are normal because during labor, we do expect for the uterus to contract. The next deceleration that I want to talk about is the late deceleration. This is not a good sign. It's actually caused by a problem with the placenta. So if we are asked to identify a late deceleration on a fetal heart strip, what we're going to see is the heart rate drops late around the peak of the contraction or the end of the contraction. And if we're looking at the heart rate of the baby, the heart rate does not recover until after the contraction is over. The treatment for late deceleration is the acronym LION, L-I-O-N. Have you heard of that before? LION is an easy way to remember the steps of intrauterine resuscitation. The first is L, which means put the mom on the left side. Yes, put the mom on the left side. The I stands for initiate or increase IV fluids. The O is oxygen, of course, but with the pregnant client, it's always by a face mask, never by nasal cannula. And then the N is to notify the healthcare providers. It's an easy way to remember what to do if a pregnant client is experiencing some complications. The last deceleration that I want to talk about is the variable kind. Yep, the variable deceleration. This is normally caused by cord compression. Maybe the cord is wrapped around the baby's neck or another body part. You just don't know. But what you do see is that the heart rate of this baby is dropping. I hope that you get a variable deceleration question on your NCLEX exam because they are super easy to identify. Variable decelerations look like a V shape. Do you see it? Yep. It helps you to remember what kind of deceleration it is. The treatment for variable decelerations are repositioning the mother and or adding fluid in the uterus. This is called intrauteral resuscitation. Now, if no improvement is made, then a C-section or cesarean section may be necessary. I want you guys to understand that fetal heart monitoring, it is an advanced clinical skill. And by just understanding the few key points that we went over about accelerations and decelerations, you are going to separate yourself from just a candidate with a basic knowledge of pregnancy. So congratulations, you guys are taking steps to be amazing nurses. Let's talk about the postpartum assessment. The biggest risk for postpartum complications is within the first 24 hours. Most commonly, a fever is the first sign of a postpartum complication. Can you guys think of what a fever might indicate to a woman who's just had a baby? It's dehydration. Yes, after pregnancy and labor, you lose a lot of fluid. So dehydration is a common complication. I want us to use the acronym BUBBLE-HE. BUBBLE-HE will allow you to remember clinically what you need to assess on the postpartum client. So each letter in BUBBLE-HE stands for a part of the body. The first B in BUBBLE-HE stands for the breasts. You have to assess them after labor. And it's very common for a woman to have what we call engorgement. And that is because milk is coming into the breast to help to nourish that baby. So for NCLEX, because engorgement is painful, we need to recommend cabbage leaves. That's right. Frozen cabbage leaves will help to reduce the pain. Uterus. The uterus should be midline and it should be firm. If there is uterine atony, then the mother may need to have a massage of her uterus. And this is to help decrease the chances of bleeding. The B in BUBBLE-HE stands for bladder. Yep, so that next B means bladder. And before you do a fundus assessment, you always want to make sure that the patient voids before that assessment, because a full bladder can misplace the uterus out of the proper position. The next B stands for bowel. You would expect a bowel movement 1 to 3 days postpartum. And constipation is a normal finding after labor. Can you think what a pregnant woman is given during labor that would cause her to be constipated afterwards? Any thoughts? It is definitely narcotics. Pain medicine will slow down everything. So we want to let our clients know that it's normal 1 to 3 days after delivery to be constipated. The L in BUBBLE-HE stands for lochia. And lochia is the discharge that is found after delivery. Remember, we need to know the 3 colors, but in general, for lochia, there should be no foul odors or no blood clots larger than a dime. It's also important that a mom is not saturating 1 pad in 15 minutes. There are 3 colors that you need to know for lochia description. The first color is rubra. Rubra means red. You expect lochia to be rubra 1 to 3 days after delivery. And the next color is called serosa. Serosa is a pinkish color that you expect 4 to 6 days after delivery. And the last color is alba. Alba means white, and you expect lochia to be white or clear for about 7 to 14 days after delivery. Hey, we have just a few more letters to go in BUBBLE-HE, and the next letter is an E, and that stands for episiotomy. If a woman has received an episiotomy during labor, as the registered nurse, you need to assess this area. You want to make sure that that episiotomy has been mended correctly and that the edges are well approximated. Hemorrhaging is a common concern because there may be pieces of the placenta that have been retained or another cause of bleeding. So we want to make sure that we are assessing the uterus for any signs of hemorrhaging. The final E stands for extremities. Oh, yes. We need to assess the lower extremities because pregnant women who have gone through labor have spent a lot of time lying in bed. And when you're lying in bed and you're not moving, blood is not moving. And so blood has a tendency to clot during this time. So we need to assess the lower extremities for edema, tenderness, varices, or increased skin temperature. There are 2 client education points that I want us to be familiar with. The first is mastitis. We cannot close this lecture without talking about mastitis. Mastitis is an inflammation of the breast tissue, and this is usually due to a staph infection. Either the mother has it on her skin or the baby has it in its and it gets inside of the breast duct. The teaching point is that for mastitis to go away, the mom has to take antibiotics. Do you guys remember what our pregnancy safe antibiotic is? It's penicillin. Write that down. Penicillin is safe to give during pregnancy or breastfeeding. So we have to teach the mom. She has to take antibiotics, and also she has to continue to empty that breast duct. So either continue to breastfeed or pump the milk. By emptying the breast duct, it also helps to promote healing. The second client education point is about medroxyprogesterone. Now, this is a birth control option for moms. Usually it's an IM injection. Now, one of the benefits of this form of birth control is that it is only given every 3 months. The teaching points about medroxyprogesterone are they do come with irregular menstrual periods. Also, weight gain is common. This form of birth control can cause photosensitivity in our clients, so they should definitely wear sunscreen when going outside. Women should notify their healthcare provider if heavy bleeding starts to occur. Okay, we have finished our pregnancy and labor overview. We have continued through electronic fetal heart monitoring and our postpartum assessment. Next, we are going to talk about the normal and high-risk newborn. All right, everyone. So you experienced the lecture portion of the V2. Again, that was the pregnancy lecture. So normally what would happen is you would just continue on with the next lecture. It will load up for you until you get to your progress exams, okay? And so I have little markers in between of the V2 platform to help you stay accountable, So most of you may already have the quick facts, but you don't have those lectures. So this is a great time during the sale to upgrade to have both, which would be the full program. Inside of the V2 is the lecture bank, the lectures and the question bank. So right now, because of the sale, we have a 1-month price for literally $2 a day. $2 a day is what the price is now for the V2, and it comes up to $69 for 1 month. You can do 3 months for $109. Remember, if you have quick facts already, just take $10 off of these prices. Okay, $10 off of these prices because you don't need to buy the book again. Every one of these packages comes with the quick facts book. So again, if you already have it, go ahead and put the quick facts that comes with the package, put it in a garbage can. All right, I'm going to show you guys how to purchase the V2 right now, how to take quick facts off for those of you who want to upgrade, and then also how to delay your start date, because some of you want to purchase V2, but then you don't want to start right away. So let's go on into line, and I'm going to open up a new tab, and then we're going to start at the website, remareview.com. Oh, another thing is I want to show you how to get the free trial of the V2, because the free trial is also needed to complete the workbook. So just really quickly, when you go to the website, all right, when you go to the website, you can join the free trial of the V2 right here. So go to remark.com. The free trial is right here. If you want to purchase the V2 program, the first thing you have to do is determine whether you're a registered nurse or a practical nurse. Let's say you're a practical nurse, all right? And then you can join the V2. It'll take you to the practical nurse, and this is where you get the packages from. So it's very important that you pick your initial time. If you know you're going to need more time, just start off, okay? Just start off with the time that you think you might need. All right. Everybody gets the downloadable V2 workbook that you can print out. But if you want to upgrade and get this workbook, this is the time that you can get it. All right. And then if you purchase this book, you will be getting 2 books. Okay. But if you don't purchase this one, I still am going to send you quick facts with every package unless you've put it in the trash can. This book also comes with the program. Okay. And then people always ask me, is this for RN or PN? This is for both RN and PNs. Everybody gets the same book. Okay. Everybody gets the same book. So if you purchase it and then you say, oh, I want to pause my subscription, I can't do that. You have to do it on the front end. So take your time when you're checking out, and make sure you're having everything that you need. It takes about 5 days to get the quick facts book to you. And if you order this at the same time, it'll take about 5 days, depending where it goes. And we send these all over internationally for this. Okay. All right, everyone. So now, how long does it take to deliver? You have any questions, put them in there. Okay. Put them in there, and I'll try to get them to them. So again, your workbook still has another lecture in it. That is normal and high risk newborn. If you get the trial version of the V2, normal and high risk newborn is in there. So you will be able to get and download. You can download another workbook as well if you want to, but you'll also be able to do that. All right. Oh, show them where the trial version is. Oh, yeah. You got to go to the website. But what I want to show you is even in the trial version, what you're going to see is all of the V2. You're going to see all of the V2 lectures in the trial version, but just this first row will be unlocked. And so you're going to start watching the pregnancy, then you'll be able to take the progress exam, and you'll be able to go from there. Okay. V2 is not something that you download. Okay. He says, I ordered yesterday. It's not something that you download. It's already available to you. So when you log in, all of these things are available. The only thing that you are downloading is your student workbook from the file vault here. Okay. The student workbook from the file vault. And this is what that printout will look like. Okay. So you'll print this out. If you don't purchase the physical one, you will still get this printed one. Okay, you will still get this printed one, and it will allow you to print it out. Okay. If you delay your start date, can you change it? Yes. If you cancel your subscription, yes. If you cancel your subscription, what's going to happen is you will go to a trial mode of the V2. And if you're ready to rejoin, you'll just rejoin it. So you'll be able to go from trial to the paid version. That's fine. Okay, what else? Do we need to cancel our subscription if we already have the V2? Delay the date until our next payment date. Just delay the date. If you have V2 and you're still within your activation time, say you got the 3 months, you're still within the 3 months, but you don't want to be charged the $50 after the 3 months, you can go ahead and cancel your subscription now, and you'll still retain all of your 3 months. There'll be no problem. It'll just be after the 3 months, you'll go into the trial mode until you're ready again. Okay. How can I upgrade my subscription? By going to your settings, or there's a banner at the top of the V2 that says upgrade. Please, how do I see how to print out the workbook? Okay, very good. Okay, so how to print out the workbook. If you go here to the file vault, this is the third tab. You click on the file vault. If you go to course resources will pull up your daily study calendar. Okay, your daily study calendar. Here's your student workbook. It is the second document in your course resources. Okay, and so it is here. Okay, and this is the study calendar. I want you guys to make sure that you're following the study calendar. I think that it helps you get through. The people who do this program in 2 weeks or, you know, a very short time, it's because they sit down with the study calendar and they do the things on the study calendar. So that's very important for you to do. But your workbook will be there. It's in your file vault. It's in your file vault, right? What else? Also, if you have any specific questions about anything, please send Team Remar a email, support@remar review. Also, I have the winners for the people who are going to win the free. There was 2 winners for 2 free NCLEX reviews. They are Anita Rodriguez and Brenda Cruz. So congratulations. Are you guys still watching? I hope so, because you won. You won. Me too, for 3 months. You won. That's amazing. Okay. All right. Oh, also make sure, well, just one quick thing. These books are PDFs. So they are PDFs that you can download. You need to have a PDF reader if you want to see these books. Okay. You need to have a PDF reader. There is books. They have this one. They have the study calendar. Also, if you go under new NCLEX resources, I have some also some NCLEX resources for you there. I have another book in here that I wrote. It's called Quick Facts for, why did that blog it? It's Quick Facts for Always Allow. Okay. Quick Facts for Pediatrics for you. So if you are in the file vault, you're able to print out this book too as well. Okay. So that is also available for you. And it's a whole nother book. It's a whole nother Quick Facts book. When you sign up for the trial version, again, you will be able to go through the first section. All right, you'll be able to go through the first section. All right. Hey, Brenda is watching. So yeah, you won. You got that email in very quickly, and we are happy that you will be getting your V2. So look out for an email from us, Brenda, and congratulations again. All right. Yes, I can go over the study calendar. Let me say just really quickly. So when you get the study calendar, there are study sessions. There are only 20 study sessions that you have to do. Every study session, you're going to watch something, you're going to read something, and you're going to answer something. Okay. So for example, let's say we are doing study session. Let me see if I can make this a little bit bigger. Okay, let's say we are going to do study session number 4. And that says we are going to watch, you're going to sit down. Today, you're going to watch medication administration and antibiotics. So those are 2 lectures. So you would literally just go here, and it would be time for you to watch medication administration and antibiotics. One video is 14 minutes. One video is 18 minutes. Can you do that? Absolutely. So you would have that, and then you're going to review your study session number 3 notes. So these are the notes that you took here. Okay. And then you're going to do clinical progress exam number 3. That is what you're going to answer. Clinical progress exam number 3 is right after antibiotics. So you don't have to go anywhere to search for it. So, I mean, in essentially 45 minutes or so, you will be done with that study session. Most people will just continue to do study session number 5 and then number 6 sometimes. So I try to make the review as doable as possible. You don't have a lot to do, but you do have to be consistent in doing it. So to sum it all up, what you're getting when you purchase V2 are my lectures that are content-based. You're getting a downloadable workbook. This is something that you print out. Okay, you're going to get this from your file vault. You're going to get this, so you'll have access to this. Just print it out. You can do it for, some people say $15, $20. It's 121 pages. If you have a printer at home, you could do it at home. If you don't want to print this book out, I can send you this one that's already printed for you. Just add it to your cart. And I'm already sending you this book. So everybody gets this book. All right. But if you add this, then you'll get 2 books. If you don't, you'll get this book plus this book. Okay. And that will help you take notes. It is very important that you do print out this book because it helps you keep track of the lectures. I've had people who've purchased my program and they say, I just listened, but I didn't write things down. You miss a lot of stuff when you don't write things down. And so part of your exercise tonight was to write down things while you listen to the lecture. All right. So that's the course. That's what I'm offering you. It is a full system. Thing I haven't shown tonight was the question bank. So let me just get into the question bank really quickly. The question bank is the second location in the V2. All right. So question bank is right here. When you click on question bank, it will take you to the question bank side. Everything is in one place. You can go into the question bank as early as you want to or as late as you want to. There's over 2,000 questions. So there's 2,500 questions here. It's easy to create a test. All right. You just click the create a test button. You name your test, whatever you want to name it, NGN, whatever. You can do the tutor mode, the test mode, or you could do a computer adaptive test. Okay. And this is where you would pick if you wanted to do that. The difficulty level is easy, moderate, or hard. It is divided by subjects. There are next gen subjects here that you can choose from if you want to do that. Case studies, all those things. And you can pick how many you want to do, whether you want it timed or untimed. And then when you pick your subjects, you just go to start a test. Oh, let me see. I got to pick, let's do a test. Okay. And then when you do that, you'll be able to create the test. All right. V2 will tell you that your test is created and it's here for you. So this part of it is very important because it allows you to go through questions when you're ready to. Okay. So again, the whole idea of the V2 was to create a system that had everything in one place. All right. And again, if you want to get into V2 and cancel your account, you can just go to settings and you'll be able to do it from there. All right. All right, everyone. So again, if you're in the trial, you can also go to settings, but I hope that our time together allowed you to see what it is that REMAR is doing to prepare these nursing students from all over the place, how to pass the exam, Where do we find the section to read after we look at the lecture? The section to read, typically what that means is what notes have you taken? So after you watch the lecture, if I say review study session number 1 or study session number 2 notes, it is to literally go back and look at everything that you have written, okay? Everything that you have written and review those notes. And then you're able to move on. Yes, you can access this with a phone. You can access this with a laptop or a tablet as well. V2 is a location. So it's a website. It's a location that you log into to study, okay? And do your questions. All right, everyone. I hope you have a very blessed night. So thank you so much for your time. And please, if you need anything specifically, send me an email, support@remarreview.com, support@remarreview.com. It's a pleasure. Thank you to all of the REMAR nurses who came on here, shared their testimony, inspired us. And then also thank you, congratulations to our winners the generous Remar nurse who said, I'm going to pay for somebody to get into this program. So that is phenomenal. All right. I hope you guys have a wonderful evening. Love your content has been served. Love your content has been served. So until next Valentine's Day, I will see you again, guys. Bye-bye.
I can't do this.
Yes, you can. Just breathe.
I can't do this.
Yes, you can.
You're not having a baby. You're taking the NCLEX. Feels like I'm having a baby. I'm gaining weight. I'm stressed about the exam date. I don't know what to expect.
That's normal. If you're having test anxiety and you're worried about failing, go to remarnurse.com. There's a 99.2% pass rate.
Professor Regina, what if I fail again? I mean, Robert is expecting new big nursing checks.
Hey, honey, bags are packed. You ready to take that test so we can get out of here and go pick up our new big fat nursing check?
Robert, out.
Okay.
Can Remar really help me pass NCLEX?
You're not gonna fail. remarnurse.com has helped hundreds of thousands of nursing students overcome test anxiety and get their nursing license.
I failed NCLEX before.
She's not a good test taker.
You're not helping. I'm not a good test taker.
That's okay. remarnurse.com is a better NCLEX review. There's better questions, better notes, better results.
Hon, I'm on remarnurse.com right now. They have everything you need to pass the test, which means big fat checks for daddy, new hot tub.
I'll get out of here so you can take care of him. If you're ready to pass NCLEX and join the hundreds of thousands of nursing students who we've already helped get a nursing license, go to remarnurse.com. You can, you will, and you must